Hi, this is Dr. Rhonda Felheim. We're going to talk about how the body handles bleeding. Um, and I love this picture of blood. Whew. Okay, look at these. You can see the little fenestrations. Okay. Uh, when we're talking about the body's response to bleeding, and we want to stop the bleeding, we the word we would use is hemostasis. Hemo, blood, stasis. You know, when something is static, we say that it's still, it's stopped. Okay, so stopping bleeding, stop the bleeding. Well, there's three mechanisms that we utilize in our body: vasospasm, platelet plug, and coagulation. And so we're going to take a look at each of these. And again, you know, one of the things I want to point out is that this word hemostasis is often confused with homeostasis. So kind of make a mental note that this is not homeostasis. This is about stopping blood flow out of capillaries, out of vessels. Okay. Let's take a look first at platelets, because we did identify them as the formed elements that participate in plugging up leaky capillaries. And so I want to just talk through where they come from. This is kind of interesting, I think. So here we are. Let's set the scene. Here we are in the bone marrow, red bone marrow, and this is a capillary. Right, this is a capillary that, you know, formed elements are being put into, and off it goes. And so this is what's called a megakaryocyte. A megakaryocyte, and appropriately named. Look at the size of this thing. Here's our erythrocytes, leukocytes, and then this megakaryocyte. Well, you can see that a portion of this megakaryocyte extends out into the capillary. Pieces of this megakaryocyte are breaking off or sealing off, and what is being sent off into the blood are what we call platelets. Okay, these are platelets. So again, these platelets are formed from the megakaryocyte. Okay, so let's take a closer look at platelets. Platelets are not just a piece of a megakaryocyte. They actually contain, look at all these vesicles that these platelets contain, and quite a variety of substances that they're capable of secreting and releasing. So here's an example: vasoconstrictors. Okay, so let's think for just a second about vasoconstrictors. When would we vasoconstrict when we're talking about platelets? Well, doesn't that make sense? We have, you know, a situation where capillaries are torn open, or arterioles, and so the platelets in the area can release vasoconstrictors, which would cause those vessels, the lumen, to shut down, and so that would reduce the blood that was flowing into the area. Procoagulants, all right, it's procoagulants. What those substances will do is stimulate the onset of processes that are going to stop this bleeding, and we're gonna look at that in a little more detail in just a second. Clot dissolving enzyme. Well, good, because once we're done with the clot, or once we don't need the clot to stop the bleeding anymore, these substances will dissolve that clot and reduce any danger of throwing a clot or anything like that. We actually just dissolve it. Chemotaxis, meaning that these platelets will chemically communicate with each other and with other cells. Now, this is something that we don't put platelets out on the front line of our immunity and saying, you know, that they protect us through being major phagocytes in our system or anything, but they are capable of consuming bacteria. Growth factor, well, secreting growth factor in the situation where you have a tear in the capillary wall, in the endothelium. What would we do? Well, stimulate healing. And then these platelets are going to participate in platelet plugs. So let's take a look at the three responses to bleeding that we originally listed, and talk about them in a little more detail. Vascular spasm. Now, what I want to point out initially is, when we have an injury to the endothelium of a capillary, collagen fibers are exposed. Okay, we expose collagen fibers as a result of the tear or the cut, and oftentimes it's the exposure of these collagen fibers that will set off these responses that we're talking about to bleeding. A smooth endothelial surface will be coated with what we call prostacyclin, and that gives the platelets a clear message that everything's fine, blood's flowing fine, and that the endothelial wall is intact. However, if collagen fibers are exposed, that's going to give them a signal that things aren't right. We've got some problems. Okay, so our first response is vascular spasm, and again, vascular spasm would be vasoconstriction, meaning reduced blood flow to the area until we can close off the injury or trauma and stop the bleeding. Okay. Now, platelet plug formation would be, we would progress to this excuse me, from vascular spasm, or in addition to vascular spasm. But the exposure of the collagen fibers then sets off the platelet plug activity. In response to that, they will secrete the procoagulants. They will secrete substances that will tell each other to get really sticky, and they will stick together, forming this plug structure. And so this will then do its part in stopping the bleeding. Excuse me. A more advanced process that's involved here, and again, these things happen very quickly. So even getting to this blood clot formation, we would go from spasm to clotting process rather quickly. And the clot, you can see, is something that involves the plug. It's just taking it to the next step. So when we talk about blood clotting, we're talking about coagulation. And we're going to see that this involves insoluble fibers being placed around and throughout the plug, and what effect that has. So let's take a look at that. These are all these fibrin, what we call fibrin, and these are insoluble fibers. You can see we have some erythrocytes in here with the platelets, and so that is a clot. That is what we refer to as coagulation, or a clot. Now, let's take a look at how we end up with these insoluble fibers that are a part of this structure that's helping to stop us from bleeding. Now, we don't get overwhelmed. It's okay. We'll talk our way through this picture. But there are two possible. You can see we have this pathway that these two separate pathways come together and merge into a common pathway. And what we're going to end up with is the fibrin that we see in the clot, the insoluble thread that we see in the clot. And so I'm going to talk you through this, two different approaches to the same destination, coagulation or clot formation. So if we start up here, we can say that under the heading of intrinsic mechanism, what we're talking about is there is damage to the endothelial wall that can be detected on the inside. Okay, so the injury is from the inside of the vessel, inside intrinsic. Okay, again, platelets will be key players. um, to begin this process. From coming from the extrinsic mechanism, that just means that we have tissue damaged from the outside in and around vessels, and that will then set off this process coming in this direction. Now, you notice that we have a number of what we call factors throughout this process. Factor 11, 7, 8, 6, 10, 1, okay, lots of fibers, and we're not going to name them specifically. They are inactive until this process begins. They're substances in the blood that will participate as this sequence unfolds. So, but you don't have to memorize each and every factor here. But let's say we have an injury that damages the tissues or damages the endothelium, and again we know that both are going to arrive at this point once this activity starts. So what I did was started right here, and I pulled this material out and put it in this box just to make it a little easier to understand. So this prothrombinase is this enzyme. Okay, so we talked about proteins that exist in the blood that are made in the liver, and prothrombin and fibrinogen are two of these clotting proteins that circulate in our blood all the time. They're there all the time, and this is where they come into play. They're going to be activated or converted to substances that will then facilitate the formation of fibrin. So this is how this works by the time you get down to this point. The prothrombin, again, an inactive protein in the clotting protein in the blood, in the presence of prothrombinase, this enzyme, will be converted to thrombin. Okay, and that's just this right here, thrombin. Now, fibrinogen, which again is a clotting protein made in the liver, circulating in the blood, in the presence of thrombin, will then become the insoluble fibrin. Okay, the insoluble fibrin. So the fibrin then are the insoluble threads woven through a clot. Okay, so one of the couple things I want to point out, obviously these calcium and vitamin K are very important in this process, and so let's locate the importance of calcium. Let's see, we have it here, 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 here. So calcium is a very important cofactor throughout the clotting process, so that's important to recognize. Now, vitamin K, I don't see vitamin K here anywhere, but vitamin K works behind the scenes to help facilitate this process. And the way that vitamin K works is vitamin K binds to specific receptor sites in the liver, and as a result of that, it stimulates the liver to produce fibrinogen, the clotting proteins. So in the absence of vitamin K, we would not be able to clot. I mean, we would bleed. So very, very important, vitamin K. Which takes me to, we talk about these medications that are what we call blood thinners, and they really don't thin the blood. We talk about, I think the one that most people recognize would be Coumadin or heparin, okay, Coumadin, or warfarin. And in lay terms, we just say, oh, they're blood thinners, and people take them after they have heart attacks and strokes to help prevent the onset of additional activity there. But I think it's very interesting to look at why those medications work or how they work. And so it's really pretty straightforward. Those medications actually work at the liver. they bind to the same sites that vitamin K would bind to, and they actually block vitamin K from binding to those sites. So if vitamin K can't bind to those sites, then the liver doesn't produce fibrinogen. Okay, so actually what those medications do is prevent clotting proteins from being made, which decreases the body's ability to clot. So, that's a good thing following a stroke. You don't want another clot to set off another stroke. You don't want another clot to set off another heart attack. So you would block the vitamin K from binding at the liver. These medications, if you've ever known anybody who's had to take them, they're very highly controlled. People have to initially be tested, their blood be tested every week to test different levels. Because you really have to be careful when you're on these medications that stop the process of clotting from occurring. Okay, just an interesting note. So, again, pretty fascinating stuff, and our body's very, very capable of taking care of this. So, I'm going to stop on that note.